Welcome back. I'm a little breathless if you saw that last segment. Yoga instructor Cassandra Pemberton took us through some paces. We're going to get Cassandra back in because I've got a point to prove. I feel totally unfit at this time. We're going to switch it up as we continue to talk about health wellness here, sponsored by Tempo, of course, on the corner of David Tile and Arpita Avenue. Their open house is happening today. You can go between 5 and 9. They're giveaways. They're going to teach you all you need to know about finding the right mattress for you to sleep on, the right pillow, and all of those things. I'm now joined by Gregory Arneaud, Clinical Director of ISD Health Solutions. And I'll tell you what ISD Health, well, Greg is going to tell you what ISD Health Solutions is all about. Greg, welcome.
Good morning.
So ISD Health Solutions, what do you do here?
Well, more or less, we try to bring the awareness of sleep disorders to the community, utilizing some different innovations such as social media, maybe radio. Having word of mouth is obviously the best form of advertising, but most people don't realize how important sleep is and how it plays a huge role in their quality of life. So we provide diagnostic tools to be diagnosed in the convenience of your own home, as versus having going to a clinic or a hospital is how it was done in the past. Technology allows us now to be able to identify and be able to determine if a person's sleep quality is meeting their needs. Overall, there's an epidemic, or we could say globally, about at least almost 100 million people are suffering from a condition called sleep apnea. It's a very common problem. Most people don't even realize it's going on for many years, and one of the many symptoms which goes sometimes ignored is loud snoring. So people who snore, looks like Lee might know someone.
Yeah, I know some people. I know some people who snore. I'm not going to commit to anything. I just know a few people who snore.
Well, you know, snoring is one of the symptoms in most cases where someone doesn't realize that this problem does exist. Your airway is starting to narrow. It could be due to an increased neck size if you're a male. And what would you say your neck size would be as a
Last time I think I measured my neck size would have been just around 15 and a half.
Okay, you're in good company. You're in good company. I'm right there too. At the same time, if you are a male and your neck size is greater than 16 and a half inches, or a female that's greater than 15 inches, there's a probability now there's more risk that the mass around that neck is causing the airway to collapse during the night, during different types of changes and stages of sleep, and the muscular tone changes. If you drink alcohol, it actually exacerbates the problem even more.
So we were having a chat before, and you were telling me something called sleep death.
Sleep debt.
That's when you don't sleep your full 8 hours to get your beauty rest. I don't get. Rarely do I even get more than 3 to 4 hours sleep before I get up and come in.
Well, you're not alone. I'm in the same boat, even though I try to promote good sleep hygiene and so forth. I myself suffer from sleep problems because sometimes my brain's going. You know, sometimes you get a call in the middle of the night, or sometimes you can't just forget what's happening that day or what you're dealing with the following day, which doesn't allow you to get a good restful sleep. On the other side of that is that you know, people don't get it. You know, sleep is essential for life. It is as important as eating, as breathing, as being able to exercise. I mean, you need to sleep to restore your body for the next day. If you are a person that is not getting at least 7 to 8 hours as an adult, you are increasing what we call sleep debt. If you need 8 hours as an adult to properly be restored for the next day, and you're getting repeatedly 4 hours and 5 hours, you're accumulating anywhere from 3 to 4 hours of sleep debt per night. So say tonight you missed 3 or 4 hours, the next night you missed 2 or 3 hours, the next night you missed 5 hours or 4 hours. As you can see, these numbers start adding up, and your body is paying the toll over time in regards to not getting that sleep. But in some cases, if it's because of a hectic, busy work schedule and you get to sleep on the weekends, you do what is called sleep rebound. So you probably end up sleeping a little longer than normal, getting in about 10 or 12 hours if you can.
I do the sleep rebound, but still not 10 to 12 hours. It just reaches somewhere close to 6 hours, and that's generally me. I can't stay down for too long. So you've got a device, a little contraption here. Tell us about this device.
Well, this device, it's a very unique device. It's the only FDA-approved device that allows you to be able to be diagnosed in the convenience of your home, and it's wireless. There aren't any belts that go around your waist like the conventional home sleep test, or any probes that go on your finger. Everything is being measured through the top portion of this device, where you're able to pick up pulse oximetry, which is your oxygen saturation, your heart rate, the positions that you sleep in to determine which particular sides you may be seeing reliefs versus other sides, where if you're sleeping on your back and you're getting the old elbow to roll over, you probably realize that while sleeping on your back, there's more of a tendency for your tongue to fall backward also into that airway, which occludes the airway and causes more apneic events. This device For those who don't believe they snore or are in denial, there is a microphone on the bottom here, an acoustic microphone that's going to pick up that snoring in decibels. And also with these probes here, these electrodes are helping us to differentiate between REM and non-REM sleep. So we have about 10 channels of information to be able to accumulate on this device. We encourage our clients to use the device for more than one night because you sleep differently every single night.
Right.
And in some cases, if you are taking medication or taking rum as a medication, in some cases to sleep, you can actually see just how that is affecting you and your sleep quality overall by comparing one night versus the other. So the patient is instructed to use this, and I'm going to show you as if you're the one going to do it tonight. We would adjust this head strap to accommodate your head size.
My head is a little big. Right.
I didn't say it. You did.
I've got a little afro. We'll just blame it on the hair.
We'll try not to mess up the do.
We'll just blame it on the hair.
And I'll loosen this up a little bit, and we'll just have you, if you can. In fact, you administer it yourself. If you were to do this test, you would just peel off these electrodes here and put it on your head. But just for demonstration purposes, you can just slide this on.
Right. So this goes on here.
And you take this nasal cannula and insert it in your nose. And what that's going to do is help us to pick up your nasal effort as you're breathing through your nose. And most often people who are snoring do breathe through their mouth. So their mouth drops. It's called the lazy jaw. And you begin that process of doing this. And so forth. Okay. So what we're going to be able to do is pick up all of that information during this test. And all you do is press a button on the top here. And if you can listen.
Right. So it's on.
You're now set to start the test. It's going to know the difference.
I can't exactly lie on my back.
Well, you're fine. It's just telling you that just to be able to get a baseline to where you're starting from.
Right.
But for the most part, we're now able to look at all the different parameters of your sleep, as we just mentioned. If you wake up in the middle of the night for any particular reason and you have to go to the restroom or drink a glass of water, you don't have to remove the headpiece. You can leave it on. When you're completely using the device for the entire night and you're ready to wake up, you just turn the device off by pressing the button, or if you slept for approximately 7 hours or more, it would automatically turn off. Take the cannula off your nose, take it over your head, and put it back in a convenient little box we'll provide for you. And then what we will do is then take this device and use this USB connector and upload the information to the internet, where we'll have a board-certified sleep physician. One is accredited by the American Academy of Sleep Medicine in the U.S. will review this data, and within 48 hours you would get your results back, a comprehensive breakdown of everything that was found in your sleep, as well as this is something that's covered by all the health insurance plans. So that's a great understanding to say, you know what, this is not just something that's cosmetic, that I want to look good and sleep better, and this is actually directly related to health, and will increase your risk in most cases of developing diabetes or high blood pressure, weight gain, cardiovascular disease, and so forth. And we don't want to talk about those sexual dysfunctions and depressions and anxieties that people are underlyingly not realizing is directly related to their sleep quality.
So ISD is located here. You've got two offices, one in Port of Spain and another down south.
Yes, we have a beautiful new location in South at Acropolis Medical at 99 Circular Road. It's amazing there. I've never seen anything like this in Trinidad. It's the U.S. spec. I mean, really nice institution. We also are located here at Ocean Rose Clinic here in Warwick Place, where you're able to come in. It's actually a clinic where you'll see medical staff there that will train you and talk to you a little bit about different types of ways to improve your sleep quality, as well as to be able to provide for you this testing option. The best part of it all is that we have a solution at the same time to be able to treat these problems.
That's interesting. Thanks, Gregory Arneaud, Clinical Director of ISD Health Solutions, and the importance of getting a good night's sleep and diagnosing sleeping disorders. So stay with us. The Good Morning Trinidad Tobago show continues after these messages.